Hey Wellness fam, how are you guys doing today? Well, whether you had an awesome day or whether you had a frustrating, tired kind of day, I'm just really glad you're here. I'm glad you're able to do something for yourself, however you prioritized it, and you're able to move your body the way you want to. So, with that, let's take some centering breaths. I'm gonna have you close your eyes. You're gonna breathe in through your nose, fill that belly, and then out through the mouth. And again, in through the nose, and then out through the mouth. Okay, so we're here in the floor series, and guess what we're gonna talk about today? Ankles, okay? So there's so many different motions in ankles that we could focus on, but again, this is just a quick, you have a busy day, you have some mobility time, which I'm proud again of you doing. So let's focus on ankle dorsiflexion. What that is your ability to be able to bring your foot back. So sometimes people are like, oh, look, I can go all the way back. I'm at 90 degrees, some farther, especially if you're an athlete. That's awesome. But yet, when you do a squat, for some reason, your feet, if you look at my feet, they fall in because you don't actually have the dorsiflexion when you're weight bearing. So we're gonna address that. So the first one, and this is like a beginner one, which is nice. Now again, you do need to have flexibility and mobility in this leg to like sit on it this way. So if you have knee pain, we can think of a modification. But if you don't, you want to have your toes and your knees in line. So from the side, it looks like this. And then all you're doing is you're leaning forward, keeping that heel on the ground. This is encouraging dorsiflexion. And if you need more, you can hold on to something and pull yourself forward. Sometimes, especially for my gym rats, I have them put a weight, not on their kneecap, please don't do that, on the muscle part of their leg and lean into it for a little bit more force. So let's do that together. You're gonna lean forward. Hold for about 5 to 10 seconds and then come back. Make sure again your heel's not up. If you cannot even get in this position, start here and then you can work on leaning forward. The goal for you will be to get farther and farther back. You also want to assess, because I see this in a lot of my basketball players, is your foot forward when you're doing this or is it out to the side so you feel like you're able to do this? Because if so, that's the problem. Start with your foot forward. Okay, let's do it on the other side. Okay, is your toe and your knee aligned? If so, you can lean forward, either push yourself or pull yourself with something. Hold for 5 to 10 seconds, and we'll do this 3 times. Good, come back. Make sure your heel's on the ground. This is how I'm gonna get my pistol squats, in case y'all are curious. Because you need it not just for regular squats, but almost every other squat you do. And one more time, forward, hold. Okay, so that's one. Another one you can work on is sitting up, curling your toes underneath, and sitting back. I know when I started this, I was actually up here and I was like, I can't go farther. So this is definitely improvement for me over the years. But honestly, I had this improvement probably in like a month or 2 with consistent practice. So you can come up and back down. Once this gets easy for you, you can see how long you can hold it here. It is a lot on the toes and the arch. So if you're tight there, This might not be an easy one for you to do right away. You can start higher up, or even start in this position to get your feet used to that. So one more time, we're gonna come back down. Ooh, I'm already feeling it now. Yep. And off. Ooh. The fun part is you can combine those two exercises by curling your toe under while you do this exercise. It's a lot harder, but it's possible. Okay. So, take a 10-minute to assess your body. What side felt more comfortable? What side felt tighter? Is this an exercise that you can do, just throw it in your day? The answer is usually yes. But that's just me, physical therapist mind and all that. Okay, perfect. So we'll stop there for today. But thank you so much for tuning in, and I look forward to more mobility sessions with you.